Good evening, listeners, and welcome to Views on Health. On the program tonight is Dr. Pravin Wijesinghe, consultant plastic surgeon from the Kothalavala Defence University Hospital. Back with us after quite a while. A warm welcome to you, Doctor.
Thank you, Fatima. Good to be back.
And for the information of our listeners, Dr. Pravin Wijesinghe is going to speak on rhinoplasty. It's quite technical. Without any further ado, I would invite you to introduce the topic.
Thanks, Fatima. It's a new topic. It's a pretty misunderstood topic, I would say. So rhino basically means nose, and plasty is basically modulating the nose. So as a definition goes, basically what it means is it's a surgical procedure to reshape the nose.
Simple as that.
As simple as that. But everyone thinks it's mainly cosmetic. Rhinoplasty could be cosmetic, and that's what people know us for as plastic surgeons. But what we do practically, we do a lot of reconstructive surgeries on the nose also. Before we go further, just to note something about a nose. Nose, although it looks like a mound on the face, it has a scaffold inside, which is made of cartilage and bone. And on the scaffold, there's a covering of skin. And if you look at what the functions of that piece of tissue is, it's basically the starting or the beginning part of a breathing passage, which ends in the lungs. So whatever changes that happen to it can affect breathing and their patterns. It also plays a part in speech, and also plays a part in moisturizing the air we breathe and modulating the temperature of the air we breathe. So there's a lot of function in it. So anything that affects that will affect the function of the patient. So it's not just about making it look good, it's also a functional part in the body.
An important function, would I say?
It's definitely an important function because whatever changes, we will talk about it a little later on, whatever changes that happen to the nose will also happen to the breathing pattern. And for example, it could be the cause for snoring. It could be a cause for recurrent chronic ear-on sinusitis, because a part of the nose has deviated to one side, blocking a sinus somewhere. It could be chronic pain. It could be a cause for headache. It could be a cause for recurrent upper respiratory tract infections. Of course, everyone knows it to be an aesthetic organ. It looks good on the face, and that's why a lot of people want to change it in certain ways to see whether they can look better.
So could you go into rhinoplasty?
Yeah, so indications for rhinoplasty or surgeries of the nose could be cosmetic. I'll talk a little bit about that later. But let's talk about the reconstructive side, which is something that people don't know about. So what are the indications for reconstructive surgery on the nose? Imagine a scenario where you've had a road traffic accident. Being the most prominent part of the face, it will get impacted first and get damaged more. And as I said, there's cartilage and bone, and of course the soft tissue covering. Any of that can get damaged. The patients might present to us immediately or present to us years later with various deformities following the trauma. It could also be part of a congenital problem. Patients might be born with a deformity of the nose. A classic example is, if you remember, a condition called cleft lip and palate, which is a fissure of the lip or the palate that you can get. And nose being a part of that same sort of complex can get affected with the same disabilities. So we do correct them in that sense. You can be born with a deviated septum. The nose gets divided into two halves by the septum, or a wall in the middle, which is again formed of cartilage and bone, by the way. And if that deviates, it will block one side of the nose. So they breathe easier on one side, but what the changes that happen with it inside will cause lots of sinus problems and so on and so forth. With regards to the surgeries we do on the nose, it can be basically divided into two forms. One is a thing called an open rhinoplasty, and the other one is a closed rhinoplasty. So as the term suggests, the closed rhinoplasty is a minimally invasive access to the nose. So we don't make skin cuts. We make small cuts inside the nose, and you can get some amount of access to the septum. So if it's a simple thing that we need corrected, a closed rhinoplasty is adequate. Open rhinoplasty is completely different. We basically dismantle the nose in a sense, so we can access each of the parts, and that's a complex structure, each of the parts individually, and change them individually to fit our need. So you can go right up to the bone, right up to the back of the septum, right up to the turbinates, or wherever we need to go. We can go in and do reconstructive surgeries on that. So open rhinoplasties can change a lot. Closed rhinoplasty, given the correct indication, is the one that it needs. So that's what the surgeries entail.
So, doctor, I mean, why would you want to do it? I mean, a person comes to you and then tells you, I have this problem. So from that point onwards, are you prepared to take that patient on for surgery?
That's a critical question, and that's where things are going wrong in certain parts of the world, including Sri Lanka, I think. When a patient comes to us, first you need to assess them whether they are here for a reconstructive surgery, which is a functional problem, or whether they are here for a cosmetic surgery, and that's the key thing first. Whatever they are there for, it's up to us to determine what the patient has and what the patient needs. Patients are sometimes unrealistic with regards to the expectations. I mean, they'd see, especially the cosmetic side of things, they'd see some nose somewhere in the paper or in pop culture somewhere, and they'll come and say, can you give us this? It's our duty to guide them, to assess them with regards to what their anatomy is already having and what can be changed within safe limits. And this takes years of training. We, as plastic surgeons, we go to these prominent centers all over the world to train on it. And some of our consultants who have retired are still going for it. So you can imagine the amount of training that is needed to make sometimes small changes outside, but we've done a lot inside to bring about those changes. So as soon as they come, we need to assess those patients to see whatever they have. Then we might need a few investigations to bring about change. Some of the structures that we want changed can't be seen from without. So we need to see them in detail. If you need to see them in detail, we might need MRI or a CT scan. Having assessed the patient and listening to what the patient wants, we come up with a plan. And most of these surgeries are complex general anesthesia surgeries where you'd come in few hours before the surgery, get admitted, and probably stay on for a day or two sometimes. What is critical to know is, with regards to the nose, as with most of the structure of the face, there are no second chances usually. I mean, there are second chances, but the second chance is not as good as the first time you do it. So it has to be said that these surgeries should be done by professionals, otherwise the outcome will not satisfy you functionally, nor would it satisfy you aesthetically.
So that is a tough call.
It is, especially in cosmetic surgery. I mean, people can be really unrealistic. So with regards to cosmetic surgeries, for example, patients may want to narrow the dorsum of the nose, which is the line on the face. Patients might have a hump that needs reduction. Patients might have a bulbous tip of the nose that wants it to be narrowed. But the patient's anatomy may not allow it. And it's up to us to convince the patient what is safe for that patient. So it takes a lot of patience, I think, to and being firm about what you think is right.
You spoke of a trauma a while ago. Now, in such situations, you have to take a decision because maybe the patient is not aware, unconscious, and not able to say what he or she wants. And then the decision is purely in the hands of the medical professionals. What happens then?
When a patient gets referred to, especially after trauma, first thing to do is make sure that the patient lives. We can't look at a nose and say, look, let's correct the nose before if the patient is having a bigger problem. So first thing is, irrespective of what the patient has superficially, we need to make sure that the patient lives. Once the patient is out of danger, then we look at certain other things in the body. And nose comes into that. So sometimes we might say, okay, the patient is really bad. We're going to put the patient into ICU, maybe intubate the patient. Nose is bad too, but then we'll just stitch it just outside, just to keep it together temporarily. let the patient recover and deal with the problems that are more superficial later on. Of course, having said that, a delayed surgery is more difficult. So it's all about coming into this compromise where we plan it according to the severity of the injury. You wouldn't want to go and do a rhinoplasty on a patient who's really ill from something else.
Any other medical conditions that they present where the nose is concerned and require surgery?
Yeah, so we do get a lot of, as I was initially saying, there are patients that are born without a nose, completely absent nose. We've started getting patients that are unfortunately coming with dog bites to the face, where the dog has completely bitten off the nose. Now, that's never going to be an aesthetic surgery. It's going to be a functional surgery where we are trying to bring about some form of a nose. With regards to the face, what we have seen is it's very difficult to replicate what we are born with. And so if you lose certain parts of the face, it's very difficult to bring about the same structure again. So we try to bring about something that resembles what they already had. We also get a lot of congenital problems where, as I said, the fissures are concerned. We get iatrogenic injuries where certain procedures in the past has affected parts of the nose, where part of the nose might die off and we need to come back and reconstruct it. Yeah, so there are fungal infections that eat away at the nose and the central face, which completely destroys and disfigures as a human being, and we need to come back and reconstruct that. Those are really, really complex procedures, and of course those patients need management of what caused it first initially, and then deal with the nasal part of things later on.
There's a question at this point in time. How many patients do you see with these conditions? Do we have large numbers?
Yeah, condition in the sense, so as a practice
wanting
goes,
surgery, medically or for cosmetic reasons?
Yeah, so as a practice goes in the government sector where we work most of our days, we do not currently offer aesthetic surgeries or cosmetic surgeries because we don't have the time for it or the resources for it. In the private sector, we do get quite a lot of patients coming in asking for surgery, but not all of them need it, and it's up to us to say what is what. But in the government sector, it's really interesting. Actually, some of those really, really complex surgeries are all offered across the board at most of the government hospital where there is a reconstructive surgeon present.
So you have many patients? I
do. So it's not as common as you think. What's happening is they do not get referred to us. So I would say most of these cases go through the mill. They go to multiple consultants and then suddenly hear about us somewhere down the line. So I think that's why this radio presentation is actually important. Just if somebody might hear about it and know a patient from in some corner of this country and then want that they can get referred to us, and that's, I think, very, very important.
So could you advise our listeners at this point in time what they should look for in their condition when it comes to their nose, and whether it's a sinusitis, it's something else, that they think they have to seek medical advice, professional advice, if they want to get over their problem, maybe surgical or medical?
Okay, so the advice I'm going to give you is separate for aesthetic, in the sense cosmetic surgery, separate for reconstructive surgery. In reconstructive surgery, it's very clear. If you have sinusitis, you're not supposed to come to plastic surgeon. You're supposed to go to an ENT surgeon. But the ENT surgeon might figure that, okay, this needs a formal rhinoplasty to correct it. If you have undergone trauma in the past and you have a deviated nose, which is not now cosmetic, now it's an aesthetic problem, because right in the middle of the face there's a deviated nose to one side. So in that sense, that's when you start coming to us. If you have with regards to cosmetic surgery, then you really need to look at yourself and be realistic about what you want. These are technically complex surgeries which can have complications. So you need to be mindful of that before you enroll in any surgery, for that matter. But especially in the nose, because if something goes wrong and it doesn't get done properly by someone, it really affects your psychology, it affects your day-to-day life, it affects the way you present yourself. You tend to hide because you can't hide the nose in the face. I mean, it's nearly impossible. So you need to be mindful of what you want.
Voice?
Yes, the nose starts from the tip of the nose and extends right back to the throat. So every time if something happens and gets blocked, even one side, the tonality of your voice gets affected. Yes, for sure.
So how is that addressed?
That's a complex problem. So the tonality of the voice gets referred to speech therapists in this country, and they do a lot of work with them. Having said all that, it's not always correctable, that tone. If you talk to them, you might be able to correct certain things, certain aspects of it, but it's not that easy to correct it completely.
Doctor spoke of people, or I would say a newborn with hardly a nose. Now, how does that work? The baby is breathing anyway.
Yeah, so when I say there's no nose the way you and I see it. There's always some hole somewhere, otherwise the child will not survive. So there has to be a connection to an air passage, otherwise it's not viable with life. So they do have something. They also have other complications. Usually when there are central problems, there might be a brain herniation, there might be vision problems. So all these patients get referred in an ideal setting. They get referred to a multidisciplinary setting where eye surgeons, ENT surgeons, neurosurgeons, plastic surgeons all get together and come up with a plan. And sometimes the cranial part or the eye part might be more important than the outward appearance of that patient. They're extremely complex, and I don't think I think there are only few hospitals in this country that would offer all those services in one setting, and that's where the trick is, where we need to find a team that looks at a patient and says, look, let's help her in this way. Sometimes it's stage surgery. It's not just one surgery to correct everything. Sometimes we correct the lip first. For example, in a lip and palate patient, we correct the lip first and then the palate, and so on and so forth. So and the nose gets corrected last at the age of 18 sometimes, where the lip and the palate gets corrected in the first year of life. So so that's what happens in most of these government hospitals where the reconstructive surgery is offered.
So doctor, if you take the nose back again and you perform cosmetic surgery, and the outcome, is it always what the patient wants, or could there be a slight difference? Would you discuss that beforehand? Look, this is what you're expecting, and this is what we're going to do, but there could be a slight difference to what you are wanting to have.
Yeah. So first thing is the procedure and the outcome needs to get discussed beforehand. You can't do one thing and say, oh, look, during surgery I did this. It's not accepted. Most of the cosmetic surgeries that we get are elective surgeries. In other words, patients are absolutely fine without the cosmetic surgery. It's just an outward appearance thing. So when the discussion happens, it's always up to us to come to a middle ground where the patient is happy and we can offer what we offer. We shouldn't, me personally, what I think is we shouldn't offer something that is unrealistic. We will always fall short. The patients will not be happy, and as I said, some of these surgeries should be done well the first time. We do not get a second chance for some of these. And also soon after the surgery there will be a lot of swelling, and the final outcome is about 6 months away. So those need to be discussed and told to the patient. The patient will not be happy otherwise. Patient coming for a bulbous tip or a wide tip will always have a wide tip soon after surgery because of swelling, and that settles down after 6 months. These can't be surprises. These have to be discussed beforehand, and that's the only way forward.
So could there be a structural change if the nose is treated medically, for medical purposes? Is that possible, that because the surgery was required for medical purposes, but as a result, down the line, there was a structural change as well?
So when they come for medical conditions with regards to the nose, it's more or less about sinusitis. And when we change it, there's always a structural change. What we are trying to do is to have a positive structural change. For example, a deviated nasal septum, a surgery for that should always give rise to a straight septum. You can't give a deviated septum again. Patients are not going to be happy. You can't block. If a patient has a block on one side, you can't create a block on the other side by relieving a block on the side that the patient came with. So likewise, these need to be discussed, and I think what is very clear is you need to go to the right people. Unfortunately, there are people who are not as qualified, who are doing certain things, and that's really important, because this is not a hidden area of your body. It's not in the back of your buttocks. It's right in smack in the middle of your face, and whatever changes are very obvious to you, and it is obvious to the others too.
Your take-home message. I think you almost said it.
Yeah, come to the right people. Go to the right people. Have a discussion. Talk to them. The doctors should take the time to explain what it is, what it entails, what the final outcome is going to be. If it's a reconstructive surgery, government hospitals that has a plastic surgeons offer it. If it's a cosmetic surgery, go to people that you know do a good job. Sometimes simple fixes are not going to be good in the long run.
And there's no quick fix.
There's never a quick fix.
Thank you, Doctor. We end this interesting discussion on rhinoplasty. And to you, Dr. Pravin Wijesinghe, consultant plastic surgeon at the Kothalavala Defence University Hospital. We thank you very much for being with us on the program and speaking on rhinoplasty.
Thank you so much.
Thank you too to Piyumi Edirisinghe for technical assistance. I'm Fatima Razi Khadi saying good night and hoping to be with you next Monday same time on Views on Health.